there, Dr. Tyler Williams from Better Sleep SLC. And today I'm here to answer a question that's often asked by our patients, by our viewers, by people searching up this question, because it can be quite a pestering and annoying issue for you or your partner or spouse or your family, and that is how to stop snoring. So many people snore, and a lot of people we meet with say, yeah, I might snore, but I don't even know, because you're asleep for it. Or they'll say, yeah, I snore, it doesn't bother me, but my kids or my spouse won't sleep in the same room as me. And if that's you, then this video is exactly for you, and I'm excited to share some things with you that could dramatically change your life and help you get through snoring. So the first thing to understand is why you snore. And there's a lot of different reasons, but one of the most common reasons we see is because your tongue is too big for your mouth or your throat. And so when you lie on your back, your tongue gets in the way and it starts to block your throat or your airway, and it makes this noise. So you can imagine, putting like a plunger in the toilet and then flushing it, and you would get kind of this bubbling or this popping noise. And it's similar, your tongue and your throat, which are damp parts of your body that allows you to swallow and breathe and chew and speak. And when your tongue gets in the way, it starts to clog up that airway, and so you get this hissing or this sawing sound of snoring. There are other reasons as well. Sometimes people have large tonsils, which can get in the way, or different medical conditions which cause that. But if you lie especially on your back, you're more likely to snore. There are different things people have done. I've talked to people who have put on a fanny pack with tennis balls in it, and so that it prevents you from rolling on your side and different things like that. But another reason we see is tooth loss. When you lose teeth, your mouth gets smaller, and that could be maybe you had teeth taken out for braces as a child or teenager, or for a retainer, or teeth you didn't have room for. That's usually not wisdom teeth. Those don't play a huge factor in this from our experience, but if you're missing teeth, your mouth gets smaller, and if you're missing teeth and they haven't been replaced, like if you're missing your molars or your back teeth, your tongue muscle can actually flatten out and get wider and longer, and that causes your tongue to expand, and it can make it easier to snore. Now, if your neck is large, typically in males, if you're a 16.5-inch neck size or larger, and you can tell that by your shirt size, or if you get a tape measure and measure that, 16.5 or larger, you're much more likely to snore or have sleep apnea, or both. And that's it doesn't take too much to get to 16.5. If you work out a lot, if you have a lot of muscle, that can cause it. If you have extra weight, you're overweight, you're not working out, you're not exercising, you're much more likely to snore. Now, some of the problems with snoring include the noise, but also a lot of people who snore also stop breathing at night. And this can be you stop breathing for just a split second. It might be half a second, 1 second, maybe less or more. And so you don't always know this, but it disrupts your sleep, and it causes you to feel more tired or groggy during the day, lack of focus. Maybe when you're driving, you get drowsy really easy, or you want to go lie down and fall asleep all the time. It can also be things like headaches and extra thirst. Dry mouth is very common. We see people who lose their teeth more quickly in our dental practice who snore. So when you snore, you're at risk for more teeth and mouth problems, bad breath. Also, a lot of people who snore or have sleep apnea grind their teeth, and that causes problems. So, some of the keys to stop snoring, is to remember that for most of us, unfortunately, it doesn't go away. As we age, our muscles tend to lose their elasticity. So in your throat and your tongue, they're not as elastic or as springy as they used to be, and so they can sag. And that, coupled with other things we mentioned, weight, tooth loss, tongue size, can cause your snoring to get worse. Now, there are some things that people have done In addition to, we talked about like different beds, and then there are appliances you can wear. So your top 3 things to stop snoring. One is get on a good sleep cycle. All right, and we have a booklet about this. If you call or text our office, we can send you a copy of this booklet, which is a guide on how to get better sleep. But the key is getting in a good sleep pattern. Okay, most adults need 7 to 9 hours of sleep, and most people are not getting 7 to 9 hours of sleep. So this can mean going to bed at a regular time, getting up at a regular time, and avoiding devices before bed, avoiding alcohol, caffeine, several hours before bed. Those are big ones. And most people are not getting good sleep, and it's a challenge. I work, I'm busy, I have 2 practices, I have a family, so I completely get it. It's not always easy to get on a regular sleep pattern, but you have to remember, if you don't take care of yourself, and if you're not getting good sleep, you can't help your family, you can't help your coworkers, you can't help your clients, your customers, your patients. And so it's very important to get on a good sleep cycle, and that involves the things we mentioned, including avoiding eating late. Okay, the second thing is different devices and appliances. Okay, so this can be snore guards, sleep apnea appliances, CPAP. Some people are candidates for surgery. All right, there are chin straps. Okay, these are things you should consult with your medical team to see which is best for you, and to see if your snoring is something else in addition to snoring, which for a lot of people it is. There are beds that provide different position, changing your mattress. Beds that can put you at an incline. Things that we talked about to keep you from sleeping on your side or rolling on your side, because when you lie, or to keep you on your side rather, because when you're on your back, you're more likely to snore. And so, some different devices and appliances. Sometimes you have to test a few of these out, and it's going to cost a few dollars to get this checked out, but it's critical to get good sleep and avoiding snoring. Then the third one is diet and exercise. It's important to exercise, shed excess weight if you need to. If you have a really muscular neck, okay, that can be a challenge because you probably don't want to stop working out. But you've got to remember, the more neck muscle or fat you have, it can encroach or crowd out your airway and your throat, and that can cause snoring to become easier. So you have to keep those things in balance. Make sure you're drinking water. Make sure you're avoiding, lots of sugar, snacks, treats. After 7 or 8 p.m., caffeine or alcohol or stimulating drinks or sedative drinks, it's really best to avoid after 3 or 4 p.m. because that can throw off your sleep cycles. A lot of sleep experts will say don't nap late in the day because that can cause your sleep to be thrown off. But, diet and exercise, you probably hear it again and again, and it's not exciting, but it does make a huge difference, and you're doing your future self a huge favor because snoring only gets worse with time if you don't do anything about it. So if you'd like some more information, a copy of the booklet, you can text or call our office. The books are just $5 for the shipping. All we ask is you pay shipping. It's a 30, 40 page book. Easy, quick read, gives you a whole bunch of tips and ideas. And if you're in the area, you can stop by and pick one free at the office. So let us know if we can help. Hope this helps with your snoring and on your journey. And, take care of yourself, most importantly, because if you don't take care of yourself, you can't help those around you. And we hope you get a better night's sleep, and it helps your family and your loved ones as well. Thanks for watching, and we'll see you next time.